Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
Today, we are diving into a medical revolution that is completely rewriting the book on weight loss. For decades, the most powerful option was a major life-altering surgery. But now, a whole new class of drugs has stormed onto the scene. And frankly, they are shaking things up in a way we've never seen before. Let's get into it. And right at the center of this whole story is this fascinating, almost unbelievable paradox. I want you to think about this question. What if the medicine we developed to treat a really nasty side effect of a surgery actually turned out to be better than the surgery itself? Just keep that in the back of your mind as we go.
All right, so for a long time, when we talked about serious, lasting weight loss, there was really only one undisputed champion, one treatment that was considered the absolute gold standard.
And that champion, it's bariatric surgery. For years, study after study has shown it's the single most effective way to achieve major weight loss and keep it off. I mean, we're talking about procedures that literally reshape a person's plumbing, their digestive system, to make it happen. And its role has only gotten bigger over time. Just look at how the guidelines have evolved. Back in 1991, the bar was set pretty high by the National Institutes of Health. But fast forward to 2022, and you see major surgical groups have broadened those criteria, making surgery an option for millions more people and really cementing its place as the #1 solution. But, even a gold standard isn't perfect. For all its incredible benefits, bariatric surgery comes with a very common and, let's be honest, a very unpleasant side effect that a lot of patients have to deal with. It's called dumping syndrome. And the name, well, it's pretty accurate. Because the surgery changes the anatomy, food can sometimes just dump into the small intestine way too fast. And when that happens, it triggers a whole cascade of really awful symptoms. And it's like a double whammy. First, you have early dumping, which hits almost right after you eat with all this digestive chaos, nausea, pain, dizziness. But then, an hour or 3 later, late dumping can kick in. And this feels like a massive blood sugar crash. We're talking weakness, sweating, confusion. It's also known as reactive hypoglycemia. And both of these can be absolutely miserable and totally disrupt someone's life.
So how do you treat it? Well, it's a step-by-step process. You start with changing your diet. If that doesn't work, you move on to medications. And in the really tough cases, the only option left is, you guessed it, another surgery to try and fix the complication from the first one. So this is no small thing. It's a serious problem that needs a serious fix.
Okay, but while all of this was the standard of care in surgery, a plot twist was brewing in a totally different corner of medicine. A new class of drugs was emerging, and they were about to change, well, pretty much everything. I'm talking about GLP-1 agonists. Now, these drugs were first made to treat type 2 diabetes, but they work by copying our natural gut hormones to make us feel full and slow down how fast our stomach empties. And when they were used for weight loss, the results were just, wow, unprecedented. It really kicked off with drugs like semaglutide. In the clinical trials, it was delivering an average weight loss of around 15%. Now, for a medicine, that was a huge deal, a real leap forward. But it didn't stop there. Oh no, the next wave brought dual agonist drugs like tirzepatide, and that pushed the number even higher. Now we're seeing an average weight loss of about 21%. The speed of this innovation was just wild. And that brings us to the latest breakthrough, a triple agonist drug called retatrutide. In its trial, it hit a mind-blowing mean weight loss of 24.2%. Just a few years ago, a number like that from a drug was pure science fiction. And right here, this is the moment it all comes together. On the left, you see the average weight loss from a sleeve gastrectomy, one of the most common weight loss surgeries, is about 22%. And on the right, that new drug, retatrutide, is already beating it. Let that sink in. A weekly injection is now delivering better weight loss results than major invasive surgery. Now that alone is a massive disruption. But remember that question I asked at the very beginning? This is where the story gets its most incredible twist. Let's connect the dots. So remember that awful late dumping syndrome, that hypoglycemic crash people can get after surgery? Well, what do you think is one of the modern go-to treatments for it? Yep, GLP-1 agonists. The exact same class of drugs, they help regulate the body's hormonal response, they stabilize blood sugar, and they can dramatically cut down or even completely eliminate those debilitating episodes. And there it is. That's the paradox. The very drug that's challenging surgery's throne as the king of weight loss is also a key treatment for one of surgery's worst side effects. The disruptor is also the cure. I mean, you just can't make this stuff up. It's an incredible turn of events. So, what on earth does this all mean for the future? With drugs this powerful now in the picture, experts are saying it's time to tear up the old rulebook and write a completely new one for treating obesity. And this is basically what that shift looks like. In the old playbook, everything was about your BMI, your body mass index. You had to hit a certain number to even qualify for surgery. But the new playbook, it suggests we start with these powerful new medications first. It's a pharmacotherapy-first approach. Surgery then becomes the tool we use for people who don't respond to the drugs, or for very specific cases. It's a total flip. And why is this so important? Because it puts the focus on a much more personalized and accessible path to treatment. It means starting with the least invasive but still incredibly effective option first, and saving a huge operation for when it's absolutely necessary. And all of this leaves us with one big final question. We are watching a paradigm shift happen in real time. It's not about if medication can compete with surgery anymore. It's already doing it. So the real question now is the future of weight loss found not in an operating room, but at the end of a prescription pad? Thanks for joining me.